Hey friends, it's Dr. Mo Anderson. I'm here today to just share some things I've learned in this journey I've been on since 2012 when I was first diagnosed with a sarcoma. And they removed part of my stomach, and then less than 2 years later the sarcoma was back, malignant, and they removed all of my stomach, my spleen, some other things, and I've been able to survive. But initially I did not thrive. And let me clear one thing in case you didn't read my bio. I am a doctor of dental surgery. I'm in healthcare, have been for 30 years, but I'm not a physician. So today I'm sharing some things that I've learned, that I've tried, that I've tested, whether it's nutritionists, oncologists, other survivors, to help me cope with the side effects. There's some things that happen because I take oral chemo daily, targeted immunotherapy, so I'm not losing my hair. But there are also some things I have to do that you have to do if you've had your stomach removed, because it's difficult to digest. So I didn't thrive at first. I lost a lot of weight. I used to be a size 8'10", and within a couple of months I was down to 0'2". That's a lot of weight loss in a very short time, and it was because I couldn't eat. I couldn't keep food down. When I did eat, the Roux-en-Y procedure, where they removed my stomach and attached my esophagus to my intestines, that had to heal. There's no flap, so you got regurgitation, right? You got GERD. If you lay down too soon after eating, your food is coming back up. If you eat too much, especially if you try to drink with it, you got to choose drink or eat. At first you're not going to be able to do both. And you know, in some European countries they give patients who've had the surgery, we've had a feeding tube so that they can get caloric intake. In hindsight, I wish I'd asked for that, because I was actually, you know, wasting muscle at one point there, and I went to a nutritionist. Get a nutritionist involved to help you if you're losing rapid weight and starting to lose muscle mass. But I'm just going to tell you, I take Gleevec, and it's oral chemo that I take daily. So there's side effects. They're mild, but they are there. They're similar to the ones that people who have chemotherapy have to cope with. So first thing you need to do is make sure you're working with a nutritionist, getting multiple vitamins, and getting a balanced diet. I'm going to tell you to not do a bunch of carbs. Yeah, you think, I'm going to get my weight on. Carbs have a lot of calories. They fill you up. And you need your vegetables, you need your fruit, you need a lot of protein. And skinny nothing for you anymore. Skinny nothing for us. We are trying to get weight on and keep it on, because without a stomach your intestines will expand a little bit, but you know, they don't do what your stomach used to do. Oh, I miss my stomach. Baby, come back. Anyway, until they come up with a stomach transplant, I'm going to say one of the things I found I deal with is energy. You just feel lethargic. And first I thought it was depression, but I'm like, no, I was back to work and just, well, bottom line, it was B12. Your stomach produces a lot of the B12, and so I tried the B12 pills, didn't get the levels high enough for me, and this is from a blood test, and so I went to B12 injections, which I do once a month. Ask your oncologist, your physician, about B12 injections if you don't have a lot of energy. Don't just do it, ask them about it. Your stomach also makes, I'm just really dry today, and I am not promoting this product, although I like it, so I'm going to do this number. Oh yeah, smoothies. Lots of smoothies. Smoothies are your friend. Smoothies are your friend. Get your fruits, get your vegetables. Good kind of sugar. Fructose is not, you know, ideal, but it's not bleached refined sugar either. So lots of smoothies. When you're having difficulty swallowing, when you're getting choked, chew slowly. chew on one side, chew on the other side, chew, 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 way more than you've ever chewed in your life. Let your teeth do some of the work that your stomach used to do. You don't have those acids and enzymes to break down food. You will love me for this one tip right there. Eat slowly, chew thoroughly. Don't do a bunch of bread, French fries, mashed potatoes. They'll fill you up. You won't be able to eat the rest of your food. The portions are going to be a lot smaller. I look at every meal as being my next 2 to 3 meals in the way that they serve them in the U.S. If you're one of my friends over in Italy or France, you probably can eat your food, but you know, we like, and I'm in Texas too, if the accent didn't give it away. Another thing that you'll deal with is, that I alluded to earlier, if you try to drink right before you eat or while you're eating, you'll get dumping syndrome. There's not enough room. The water or the Grey Goose, whatever it is that you're drinking, will just flush that food right through you. You will learn the location of every restroom in the vicinity. My doctor recommended that I take, with meals, that I take Imodium. I take 1 Imodium pill with my meals, and that stopped that from happening for me because it was embarrassing. I didn't want to eat with people. Again, I wasn't gaining weight because your intestines, for the absorption that they can do, and they can do a lot, but you're not getting all the nutrients you used to get, and you certainly don't need food rushing through, and at bedtime as well. So again, we're going to check with our MD. Please put that disclaimer on the screen for the folks. And then we've got Imodium or whatever brand you want to use, antidiarrheal in the liquid form. I travel with these. I keep them in my purse, and not as much gas, not as much running to the bathroom. If you overdo it, you'll go the opposite direction with constipation. So again, work with your healthcare people, but that one helped me a lot. I also was having a lot of cramps, and I try to stay hydrated, but that's one of the side effects of my medication is muscle cramps and muscle pain. I have tried everything. That bar of soap, there's a particular brand that they say underneath the sheets. That's how desperate I was. I'm a biology major. These cramps were so bad. My hands, I think I have some photos, but my hands, my feet, just, I could be driving. That doesn't happen anymore, thank goodness. Now it's more when I get really hot or hold my hands in a certain position for a long time, and they come. And you can function, but it's painful, and initially, come to think about it, I would just not even be able to function. So I'm going to say that you look into getting, this is one product I will heartily tell you about, pickle juice. It's not the pickle juice, just, you know, you emptying out of your jar in the refrigerator. This one has, it's extra strength pickle juice. It's a very memorable, I don't have a camera person today, so just enlarge your screen. There's nobody to zoom in. Purpose-built formula, the functional evolution of pickle juice, supplying athletes since 2001. And I want to say it's a Texas company. I need to reach out to these folks, but it's, let's see, look at me with my old eyes trying to read. Dual filtered water, organic vinegar, salt, organic dill oil, potassium, zinc, vitamin C, vitamin E, all things I can pronounce, all things that are good for you. If I feel cramps coming on, I can do half of one of these because I'm kind of small, and within minutes they're gone. I have tried everything anybody would recommend, Gatorade, the other kind of pickle juice right from the pickles, just you name it. You name it! I tried it. This stuff is the truth. Some people think it's funny that I have to take off work sometimes, even though I work at home. But if you look at my hand right now, I'm not doing that on purpose. I cannot get these cramps out of my hand. So it's kind of hard to grip a mouse and do my job when I cannot stop my finger doing that. I've taken some Gatorade, and it will go away in a minute, and then the muscles will be really sore. But you have people on chemo meds, you can't just go by how they look. There's some stuff that goes with it, and just can't always see that. I mean, this literally, this finger will just spasm and go straight if I don't hold it like this. I'm drinking Gatorade, I'm hydrated, temperature is good. There we go. Now I can try to work, but it is what it is. More good days than bad, but sometimes it happens all over my body, and sometimes it doesn't. Okay, back to work. Last thing, and I'm just mixing all kind of problems here together, but we're just kind of talking about side effects. And one of the things with chemo, some of you are on blood thinners, is that you bruise easily. And I found a product, ladies and men, I had the opportunity to meet Fantasia, and she's a wonderful singer, and I took a picture with her. Got to talk with her for a few minutes. So cool, great energy. But when I looked at the picture later, I was like, man, Fantasia's legs are just flawless, you know. Did she run in the street, get insect bites? Doesn't she bump and bruise herself? So then I started looking at other celebrities, because I don't do a beauty blog. I'm not all into all the different products. I got things to do. I make money moves. So when I noticed no one had any flaws on their legs, Christina Aguilera, no one, I did start Googling, and I found this product, Derma Blend. So for those of you who are gals, bruises can be embarrassing on our arms and legs, just, you know, whatever you bump into. All of a sudden, you got this big bruise, you don't even remember hitting yourself. This product comes in lots of different colors. They've got it on Amazon and some other places. I'm not putting any links because I'm not trying to sell these products. I'm just telling you some things that help me so that you get the idea, the juices start flowing. And last but not least, no stomach for cancer, folks. These are digestive enzymes, my digestive enzymes. And that was the biggest thing I'm going to say out of everything in terms of me. And people, you can get digestive enzymes at your drugstore. I mean, prescription strength, and some people with no stomach like me may find that they want prescription strength. I take them with my meals, and again, you know, the stomach breaks down a lot of your food. And so those enzymes help, and I know that I begin to absorb more of my food. It's got to be broken down right for you to absorb, because I begin to gain weight when I started using the digestive enzymes, drinking more smoothies, and just getting my mind right. Meditate, get all the rest you can, don't overdo it, delegate, collaborate, and have a positive mindset. I've got other videos on here. You can subscribe and you'll see I've got motivational, inspirational things. I share my faith. Whatever it is that you do to center yourself and get yourself some peace of mind, all these other products combined will only complement your peace of mind and your optimism that you're going to get beyond this moment, because the side effects are going to keep coming. It's expected, it's going to happen, but learn to manage those and to manage your stress, and it's just all good from there. It is all good. Good luck to you. Thanks for watching my video. Please subscribe, and I'll be back to share some more tips that I've learned on my journey. Take care.